Hello, everyone, and welcome to Mutual Responsibility's first virtual roundtable called Together Envisioning the Ideal Healthcare System. My name is Alex Eisen, and I will be your host for today's discussion.
Stu.
And joining me today are a diverse group of very distinguished healthcare professionals from all various sectors of the industry. And I am super excited. I'm glad. I think I will learn something, and I hope our viewers will learn something as well. Um, let me read a few statistics for you before we start that our content editors provided. According to the World Healthcare Organization, the United States healthcare system is ranked 38th in the world in terms of effectiveness. This ranks the U.S. system behind countries such as Greece, which is 14th, Saudi Arabia, which is 26, Costa Rica, which is 37th. It is just to name a few. And while ranked 38th in effectiveness in terms of providing health care for its people, the U.S. system is ranked #1 in one aspect in the world, and that's expenditure per capita for its system. So today we could talk about U.S. We could talk about more globally. We could discuss this from many perspectives, and I hope that tonight's roundtable, the panelists will depict their ideal healthcare system, what it looks like, what they envision it to be. They will tell us what they like, what they don't like about the current system, and where do they think it's heading, and what direction they would like to see it going. So, in addition to their input, we'll encourage all of you who are watching us tonight virtually to participate via chat. You can send comments, questions to mutualresponsibility.org/roundtable. You should see a chat box there. As well as if you're watching this live on YouTube, you can post comments under the Hangout. So let's begin and meet the panelists with whom we'll be discussing tonight's topic. Again, it is Together Envisioning the Ideal Healthcare System. So let's go right to left, and please let us know your name, where you're from, a little bit about your background, and don't just yet give away all the pros and cons yet. We'll get into the questions with that. So, thanks. Zsolt, can we start with you?
Okay, thank you very much. My name is Zsolt Herman. I'm originally Hungarian, living in New Zealand at the moment. I'm an orthopedic surgeon and have experience with the health system in 3 different countries. And I'm very excited and happy to be here because I'm more and more worried about where usual general health service is going wherever I'm looking. So I'm looking forward to the discussion. Thank you.
Steve, go ahead.
My name is Steve Scheckman. I'm a psychologist. I've been working in the field of healthcare, working in various systems, school systems, as well as private practice. Now I'm working in a nonprofit drug and alcohol setting. And over the years, I moved from the more traditional to a more of a holistic approach. I'm living in Pennsylvania, and healthcare is in big disarray and in a state of change. I'd love to see a change in a better, healthier direction.
Sonia, go ahead.
Hi, I'm Sonia Gregerson, and I live in California, and I've been a nurse for probably about 40 years altogether. I've done hospital-based nursing in orthopedics and medical surgical. I've done home health as well, so now at this time I work as a workers' comp case manager for a a insurance company actually on that other side, so I am aware of both sides of the medical and the insurance aspect of it as well. And I do agree that our healthcare system needs to be overhauled, and I think that as Americans and others who have joined us here in this country, that we can overcome this. Thank you.
Thank you, Sonia. Siv, go ahead.
Yeah, hello, my name is Siv. I'm from Norway. I'm a nurse. My experience is in the Norwegian healthcare system. I have been working in a neurosurgeon department for 13 years now, and before that I was working with geriatric and sinal people. So I have it from kind of both ends, and also have some private experience to be family to people who are sick as well. So it's lots to be taken care of, that's for sure, and I think it's a global problem, not only here and there. Thank you.
Okay, next we have Sarah.
Hi, my name is Sarah Gluck. I live in New York, and I am both a movement and fitness and wellness therapist, often working with people that have somehow been neglected by the system or being pushed into scenarios which either don't serve them or they've already tried and have failed. And I'm also a designer trained as an architect, and my company, Urban Movement Design, works to bring awareness of health and mobility into our urban environments. I'm really happy to be here. Thank you.
Thank you. David?
My name is David Kostenberg. I was born and educated in Russia. After university, I was working 10 years in a hospital, Russian hospital. My occupation is human physiologist. And in Canada, we already about 17 years, and I work for pharmaceutical industry.
Thank you. And Alex, last but not least.
Yeah, thank you very much for inviting me. I start my career as the surgeon about 30 years ago, and for 10 years I was surgeon in Russia, urologist. And then I moved to the United States, and little by little I shifted from conventional medicine to holistic medicine, which is basically a combination of both, get the best of both of them. And because of the Obamacare started experiment in Massachusetts, we experienced this enormous changes in the healthcare in Massachusetts for 3 years that pushed me to the edge. So I basically closed my business and get away from insurance companies, and opened a brand new next month, a brand new integral medicine in Boston. Thank you.
Thanks, everyone. This is quite an international crowd. I'm very excited. I think just the fact that people like this have already got together is starting to give me hope. I'm not an expert in health by any means, but I think it's I certainly know how many systematic sort of issues are rising everywhere, and it's an important topic from so many angles. So I'm really glad that we've gotten everyone together. Next, I will try to play a video clip for you, which is a mutual responsibility roundtable, introduction to the roundtables, and then we'll go over the rules, and then we have 4 questions for you that we'll try to get through quickly, and then we will take questions from the chat if our viewers have any comments or questions. So let's attempt this.
social platform around which different people can gather.
They come from all walks of life. Men, women, rich, poor, old, young, every skin color, everyone, simply everyone. We're all one family, citizens of this planet. So we sit around a table, which is round, because we're all equals.
And he has founded the Open Spaces Dialogue community on Facebook to facilitate discussions and encourage cooperation on a variety of social and community issues.
And we discuss how we can build here a more balanced society.
Better society with better values.
A more just society.
This time, my mind is blind to what it finds in LA or the New York Times.
Look, take a look at the systemic issues that are going on right now. It's not one thing.
I think the art of gentle revolution can take many forms, but I strongly believe that education is the most pivotal one.
It was born out of a true need that people had to talk to each other, to voice themselves. During the recent social unrest, we noticed that there was an undeniable need for people to discuss, to connect. So we started organizing.
At some point, we became completely interconnected and interdependent. And this is the word, this is the most important word in terms of mutual responsibility. We are interdependent.
People's response was amazing.
People's response was amazing. They started coming and asking questions and participating.
The audience plays a significant role in the roundtable.
Everyone can express an opinion. The others listen, reflect, respond.
I'm not sure our viewers are able to see the entire video, but we'll switch back and I will read you the rest of the. Yeah, mutual responsibility is an amazing sort of organization, growing network of people around the world, and the roundtables that we've been hosting are basically a platform of discussion of social discourse. And the goal of the roundtable is basically to build a mutual, warm environment in which everyone contributes together equally. And in order to ensure this, every opinion expressed is seen as valid, and the one that is the one that came before it, and there's no criticism. And I know that professional opinions can often, be very, very opposing, but here we will adhere to these rules, and they're essential to our success. We're really sort of, it's as if we're sitting around a dinner table and having a discussion. So without further ado, we'll move on to the first question. And please try to be brief so everybody gets a chance. But here, it's sort of a two-part question. What do you and what don't you like about the current healthcare system? So what do you and what don't you like about the current healthcare system? So again, we'll start with right to left, and I'll just change the focus to you. So Zod, go ahead.
Thank you. Well, unfortunately, the don't is much more than what I do like. I think the biggest problem what I see is that the traditional patient-doctor relationship is pushed to the background, and there are lots of things which are much more important. First of all, money. Most of the healthcare systems in the Western societies is just spiraling around the costs and money. Also, what we can see in England, for example, and in New Zealand, is that the over-management of the hospitals and the health system is distancing the treatment from the patient, and basically the patients become statistics or numbers. But maybe one of the biggest problems is that all parts of the health system, which is like a huge mosaic, the pieces are moving away from each other. All parts are isolated. There is no proper communication or cooperation, and somehow the patient is lost in this. What I do like is that I think our knowledge about how the human body works, how we could actually treat people or even prevent diseases is fantastic. I mean, we have achieved a very good basic knowledge. We have fantastic technological capabilities, and as we are discussing this issue here from all parts of the planet, virtual connections could enable us to achieve better cooperation. So there are positive sides, but I'll leave it later on. So I pass it on to Steve. Thank you.
Go ahead, Steve. Stephen, can you hear us?
Yes. In terms of working with the system, I've been working, helping people for over 40 years, and working with the insurance industry in the good old days in the beginning, and we're talking maybe 30 years ago, the patient had more power in terms of who they could select to be the person to help them. And what it evolved into with managed care was my name being somewhere on a list, filling out a form somewhere, and generally someone would pick you because you live closer to them. And so the connection to people got lost, at least for me. And in that process, it was harder and harder to make a living. So part of what I had to do was to make a choice. And it was hard to survive finding people to provide the kind of service I wanted to give. And eventually I had a part-time practice and went and joined a nonprofit organization that works with people. And the difference is insurance is secondary to how we offer our treatment. And they offer scholarships to people who can't afford to pay. There is a certain amount that the person has to commit to, but the thing that I'm trying to get to is we use a multidisciplinary approach to working with a person, which was really part of my orientation from the beginning. And that seems to be missing, the human factor. When you deal with an insurance company, it's kind of like you're fighting about some concept and perhaps a criteria in a book, and not so much a person, or looking at different dimensions of a person, but are they meeting criteria? And I think that's what we have to turn around, that yes, that is very important and it must be a guideline, but we're working with people and it's beyond the diagnosis of what's going on. In the work that I'm doing, it's at times a life and death issue, but the person themselves has to make a choice to change. And I think that's key in the quality of the kind of relationship that I can have with people. I get to reestablish that and in a sense have surpassed the system, but the system does need to change to address the human condition. And that's what's been missing here. We've evolved.
Well, we'll go to Sonia, and it looks like we've lost Steve.
Okay. I really liked what Steve and Zolt said, and I do have to agree with some of those things. I do see that medicine has become a business, and because it's become a business, people get into it, I think, to become wealthy, and they forget all about the patients. And that's certainly not what most of us got into this kind of profession for. If I wanted to be a business person, I would have done that. But I do like to say that I do like the HMO concept, such as what Kaiser has, because like it or not, we have a lot of patients who, because of the money situation, don't take care of themselves, aren't able to get the care they need. And I think the template that the HMO system uses is something that we can and should probably look at in a deeper way. I also believe that education is very important. There's a lot of uneducated people who don't understand when they should really come and see a physician or someone, And this is a big problem in my business. As you know, I work with workers' comp patients, and many of my patients are basically migrant workers, and this is a big issue for them. So that's kind of what I like and what I don't like.
Thank you.
I come from a healthcare system which is having other sources for money, so the advantage of money is that big in the system. People don't become doctors to get rich. Then you get to become an engineer. You don't get to become a nurse to get rich. You become something else. So most of the people who are working with these kind of issues in Norway is not there because of the money, but because they like to work with people somehow, or they want to discover something new, to research something, to become a better doctor or better nurse. And in this race with money and with lots of ideology and people burning desire for helping, it's easy to lose the perspective of human life. So it's we have stretched the limit of healthcare to in the Western world. I think we have stretched it too far. So it's we prolong lives which shouldn't be prolonged, and if we do prolong a life, we prolong it to something which don't have rehabilitation afterwards. So we prolong it to something for staying in bed, or a half life, or something which they can't go back to work. We don't make a question mark about what we are doing. We are just saving lives and giving them health care and giving them medicines and staying in hospital for all means. So I think it's a bigger issue on this, and I also think it's about the attitude of the population, which this growing of the healthcare and wealth in the Western world have provided with, is that people don't. You are not supposed to die anymore. You are not supposed to be sick, or life should be like a pink cloud. So many people are diagnosed as depressive, or there are many mental disorders because they don't fit into the system which we are living in today. Because most human life is not perfect, and life does hurt, and sometimes you get sick, and it's a pain in the butt to be sick. And sometimes your boyfriend or your husband or whatever goes away from you. Some in your family die, and this is normal things in life, but it's treated as abnormal and as crisis. And I think we need to work here, because we need to normalize life. That life is both bad and good. And this, I think, is a really important point, and also it should be a discussion. Where do we start treatment? Should we operate babies in the stomach of a mother? Do we know the consequence? Do the mother know the consequence of it? Usually it means that this baby is going to be operated like 20 times before it reaches the age of 3. And this means lots of pain for the baby. And who are we doing this for? And also, it doesn't mean that they can go to school and play like normal kids. It has lots of side effects to them. So we don't make question mark about this. We are just developing and developing the healthcare system, and we are saving more and more things. I say things with purpose because in the end, it's we are pushing in both directions. For instance, in my country, we don't have a population growth, but we don't die. We don't have children who is dying, and elder people are not dying either. So we standing still in the population because people are getting older, and so it's good. In many cases, it's good. But this is silent discussion. This is really silent discussion. You have a discussion that the people should be able to end their life in if they have pain. And this discussion is wide and clear, but this prolonging discussion is really silent all over the world. And also, so this is kind of my point of view, and I think it's many good things in the healthcare system. For instance, in hospital, for the acute help, then the healthcare system function. I think it functions mostly all over the world. If you need help, you got a heart attack, you get the instant help, but afterwards, then it's different where it works and don't works. Thank you.
Thank you, Sid. Yeah, let's get a few more perspectives. I think we do the question. Sarah and David and Alex, what do you or what don't you like about the current healthcare system?
Yeah, it's again, I'm probably going to lean a little bit more about what I don't like about it. I hope that will change, and I hope that things pretty soon will change. But right now, that's kind of what I see. First of all, I think there's a big question of what we mean by healthcare, because where we're at now is we have a sick care system. We don't have a healthcare system. Historically, in China, they had a healthcare system where there was a personal relationship between an individual, every individual, and a healthcare provider. And the job of the healthcare provider was to keep that person healthy. And they got a retainer every month, and that was their job. And as soon as that person got sick, they stopped paying the retainer until they got well again. So we're in an opposite system here, and everything in life is an exchange. And this idea of exchange between an individual and their healthcare provider has been co-opted by insurance companies and private companies that are making profits on people's sickness. Then we also have science that is being corrupted by the studies that they do in order to do the research that they need to do to develop different systems of health care, and put quotation marks around it, where we have other individuals and companies that are profiting at putting those people into a situation where they're then having to utilize these systems. And then we're putting doctors in a position where at one point, and it wasn't that long ago, because my father's not a doctor, but many of my friends growing up's fathers were doctors, and they were very caring and loving individuals that went into that profession because they wanted to help people. And that relationship has completely changed. People that want to help people in these days don't really go into medicine, because medicine is not a place where you can have a heart anymore. And it's a real shame. And just like, I think it was maybe Steve that said, the power has really been taken away from the individual, where the individual recognizes that health is, first of all, a birthright, and secondly, it is a lifestyle, and all of the choices that you make go towards whether you're going to be healthy or not. Health is not just a physical issue. The mind-body is a complex, and it works together in all ways. We are integral beings. We are, every part of us feeds another system. And the fact that we have taken this to believe that one muscle is separated from another muscle, that we can name every little tiny cell of the body and think that it's separate from another cell of the body, is complete insanity. And unfortunately, it's the population that suffers because of it. So we've really lost the idea that health is something that each of us, that belongs to each of us, is our responsibility, and that healthcare providers are those that are guides to us, that help us make better choices, that inform us better of things that we either have a block to, or we just don't intuitively know, or we've forgotten somehow. And instead we've put it into, well, it used to be in the hands of doctors, and now it's in the care of insurance providers and private companies. And I didn't say a lot of good stuff, so maybe we can get to it later.
Yes, that'll be in the second round of questions. David, what do you like or don't like about the current healthcare system?
I live in Canada, and there is a big myth between Canadians. If you will ask Canadians, over 90% of Canadians will answer what Canadian healthcare system the best in the world. But it's not the truth. As per Canadian statistics, Canada only hold about 10th place in the world among the developed countries. Everybody thinks was healthcare system in Canada for free, but it's wrong. We pay more than Americans, and we pay more than many other nations for our health system just upfront as our taxes. And the other side of the coin regarding Canadian system, we have to wait for a long time to see our doctor. For instance, in Germany, if you needed a doctor appointment, you wait for about few days only. In Canada, it could be a month or so. So you can easily die before you see the doctor. Other problem I would raise it's another angle of the problem of healthcare system is modern medicine. There is a terminology as modern medicine because it's not any more traditional medicine as we used to see when doctors treat the patient, not the disease. Now doctors treat the symptoms most of the time. So I agree with my colleague around round table. What if you have something wrong in your body? So most of the time doctors treat this symptom only, not the cause of the disease. Human body, the modern medicine look at like a robot. So they treat finger, they treat leg, whatever happened, they treat this because they have no time and money to spend on the whole body. And whole body is not a robot, it's everything interchange. All the systems in the body is interrelated. It's impossible to pick up the one organ or one system and treat it. Everything together. So modern medicine doesn't look at the body as a whole. They treat only symptoms. So if I'll be the boss, I will change this approach as well. Thank you.
Thank you, David. And Alex?
I'm glad I'm the last one because basically it's a wonderful round table. You basically said almost everything that I wanted to say, but I would say that in the contrary to all these complaints, I love this current medicine. This is the best thing happened to humanity in every aspect of it. The absurd of development of the current system push everybody to stay healthy because it's very dangerous for the person to even go to the hospital, because when you go to the hospital you'll wait 8 hours in emergency room until you collapse there, and then you have 75 people rescuing you right away. So medicine is wonderful. You can revive corpse basically and make them on a tube live for a long time, providing long-standing return customers for drugs and consults and everything else. As a business part of it, business part of it is perfect. And I think that the food industry works hand to hand with the system. If we combine all together, it's sickness system. It's not wellness system. It's not healthcare system. I would call it health don't care system. And then this is where we are. So how can we change it? I was breaking my head thinking of how can we change the system from bad and good, but I'll leave it for the next question probably to let other people say something. Thank you.
Thank you, Alex. Yeah, and thanks everyone. It's amazing the diversity of perspectives, and yet I sense this deep sense of concern from everyone. So on one hand, we have these amazing advanced technologies that are prolonging life, and on the other hand, we see these, like many participants said, these disconnected systems, and people are just becoming statistics, and there's kind of lack of awareness of education for people to even make their own choices, and this medicine profession, has become just a high-paying job, and you throw money into the mix, and everything's sort of become very impersonal. So. But I see that all of you have ideas and all of you have aspirations, and I think you all see a positive future. So in our second question, let's try to go a little faster, sort of make it more of a blitz round, because I want to get through all the questions with you guys. All of you have something amazing to say, and in this next round, basically what we want to do is we want to imagine that sort of next state of the future of the healthcare system. So. If we take all the positives that all of you guys mentioned, imagining all that, taking all that together, if we were to implement those things, how would you see this new different system? So let's go right to left again.
Thank you. Well, I think the first question really opened up a Pandora's box, and it's like little balls running in all directions. So how do we collect it? I think we have the technology, we have the knowledge. Most importantly, we have the experience, and as you could hear from all the other speakers, we have the awareness that something is not right. So I think if we put it together and with education increase this awareness that we cannot go on like this, but we have to connect all together what we already have to try to combine it. And I think most important is to put the patient back into the middle of the system. That basically, as the other panelists said, first of all, to make a wellness system instead of a sickness system, and try to keep people healthy instead of trying to treat them when they're already sick. So I think if the two keywords would be communication, connecting, and making people healthy instead of treating sick people. Thank you.
Thank you. And Steve, how would you see things be different? Steve, I believe your microphone's still muted. Why don't we go to Sonia, and then we come back to you, Steve. Sonia, how would you see things be different in this new envisioning system?
Well, I see it as we can. I like more of the tertiary system. Like I said before, I do like the HMO template. I believe that we need more family providers, physicians, family physicians, because I think they do the most as far as helping and educating the patients. And then the next thing is I really believe that nurse practitioners and physician assistants are really key to all of this, because both of those providers can see patients that are at, if they're not emergency type patients, they can see them, they can treat them, and then if there's a specific thing that's been diagnosed, such as say cancer is found or another disease per se, then the family physician can then make a referral to the specialist at that point. But at least the patient has an overall system, so you don't always have to see the family physician. You can see the nurse practitioner, the physician assistant, either one of them. And I think that that's, you know, just one of the ways that we can sort of bring all of these people in, and that way we can also bring in educators for different diseases, and or as what Sarah was talking about, you know, people who understand alternative kind of medicine, because I think that is another place where we need to look at as well. Thanks.
Siv, how do you envision the future of the healthcare system?
My favorite question. No,
Taking the best. How would you envision new healthcare?
I vision it this way, that I love it when I see people who is good at things working together. And as we said in the beginning, most of us, we are treating one part of the body. We are not treating the whole body. So in order to make this, I still think, and also the attitude that to treat somebody who is ill is a symptom of the society of some reason, and we need to get this person back to the society and not to have them stay in the healthcare system, which is most of the case now, because if they get chronically ill, they will stay in the healthcare system forever, and yeah, many people benefits for this. But the benefit should be to get them back to work, off painkillers, off whatever the medication they get, because if we are honest, most medication people use every day is not any good. It only makes more diseases for them. So if all the alternative people could work with the modern doctors and nurses and treat the patient together, then I think we would have a much more benefit and actually get healthy people and not chronical ill people. And I also think that we should have a huge focus, not that every healthy person should go to the doctor all the time. Why should they? If they are healthy, they are healthy. Why check that all the time? But rather to educate people to look for symptoms. If this is wrong, then you should see a doctor. If you feel these kind of things, then you should see a doctor. And also more the awareness of that it's ups and downs in life. Get more awareness to people that you don't need to have a diagnose to get an understanding from people. We need to educate the people about life, because we are not living life anymore. We are not dealing with normal things which belongs to life in a normal way. We treat them as crisis, and this make everything like sick care instead of help care and working together. So I think it's many levels in this, really many levels, and I can talk for days, so thank you.
Thank you, Siv. That's there.
I think if we're talking about, I'd like to first envision not a healthcare system, but a society where every individual is educated and taught and inspired to be the main participant in their life, and to recognize that health is a responsibility that we're given when we're given this body, when we enter this world. The body doesn't, it's not a robot. It doesn't just maintain itself. It needs to be maintained. It needs to be sustained. It needs to be fed well, not just by food, but by other things. Our healthcare system needs to support that. And when the healthcare system supports that, and there is a correct connection between all of the individuals within a healthcare system, then we all come together to recognize that it's our job to keep people healthy. And if for some reason somebody has not been educated properly, it's our job to educate. If we don't have the means to treat what it is that they need treatment for, whether they're sick or not, then we have an open dialogue, an open relationship with other practitioners that do have those abilities, and it's not, it's not about sending them to the person that you'll make money on. I think, like Siv said also, life is not just a fairy tale. It's not all about everybody is meant to live to 120 years old, and it's our job as a healthcare system to keep everybody living, regardless of what it takes or what it means to do so. But rather, we also treat sickness as it's not always meant to keep people alive or keep people the way that we think they're supposed to be kept. There's tons of research done to show that people that have gone through major traumas in their life, be they physical, emotional, whatever, that after a short period of time, they look at that trauma as the best thing that ever happened to them. And I myself have worked with countless individuals like this, and it is inspiring and incredible, and something that you don't need to wait until a trauma happens to you, but that we recognize that when we are given something in our life, whether it's cancer or whatever it is, that we're treating not the sickness but the individual. And sometimes the individual just needs to feel peaceful, just needs to feel supported, just needs to feel that everything is fine and that there's something else in life besides just your physical body, doing exactly what we think it's supposed to do or looking the way it's supposed to look. So in my perfect world, we would have a society where all of us, whether we're individuals or healthcare providers, recognize that health is something that we each need to take as a responsibility and that we need to hold as a responsibility for one another.
Thank you. And David?
I think what to change the healthcare system all around the world, we should first educate the population, starting from the very beginning, from the schools. So the same as father teach his son to do simple repair at home, you should teach people how to treat themselves. Not be panic in different cases. Probably you don't need to see medical doctor at all. Probably you just need to take more walking around and take fresh air and change the eating style and change your diet and so on, so on. So if you will start from the very beginning, from the school, so kids who goes to the medical institutes, medical universities, medical schools, they will know already what human body, it's not robot, it's a system. So to teach these students will be much easier. So medical doctors will be different. Same kids who go to the school and graduate economy and become ministers of health and so on, also will understand the system, and so on, so on. Everybody will be surprised if if they will know the numbers, and numbers show amazing facts. Like America spent almost 18% of national gross product on healthcare system. And it's known fact what only 50% comes to the healthcare system, another 50% distributed among bureaucrats, including insurance company, including all the bureaucrats. So imagine 50% of this money goes to them. So other countries also, it's not the perfect system. So we need educate people first, and then try to resolve economical, medical, and other problems. Education is the first. Thank you.
And Alex, you won't get away with being last. We'll go back to Stephen after you. So go ahead. How do you envision this new, different, rebuilt healthcare system?
I think that you already said a lot of it, but I think that the only thing that we have to do is to change value, change the payments. If doctors and nurses and people who are doing the service for the people will get as the payment smile and happiness instead of money, everything will be changed overnight. Because if we are thinking of how to make people happy, how to be happy around people, then we start to shift, we start to move into different relationships. And I think that the structure that we have today is very heavy structure with, like David says, with bureaucrats and the whole thing. Is the system is very heavy, and when I thought about how can we change it from above, from below, and I thought that we don't have to do anything. Let this system die gracefully. It will die very soon. And instead of changing it, we have to build on a side absolutely new system that have different values of teaching people of right things to do. In my book, the prevention is not how many mammograms did you do, how many colonoscopies did you do, and how many times did you do physical with the blood work and everything else. If you have any room for improvement on your physical, emotional level, mental level, spiritual connection, connection with the people, if we'll be able to improve this area, then disease will disappear. Disease is something temporary. It's not really something. We make acute diseases chronic. In my clinic, diabetes type 2 doesn't exist. It's a temporary condition where you start to educate person on what has to be done about food, about movement, about relationship with the people. The diabetes disappeared without pills, without anything. The same thing will go with the hypertension. This disease doesn't exist. It's our wrong lifestyle. So physician, doctor, if you translate from the Latin, is the teacher. So what we have to do, we have to educate people, and this is where I see the future of the medicine, where we all collectively start to educate people, stay away from bad habits, and also stimulate with the group sessions, and then people will not have diseases. So the system will die by itself. Great. Who's next?
Steven. I still can't hear you. I'm sorry, Steven. See if you can get your audio back. We'll jump to the next one. But I'm sure whatever you're saying is good. I'm sure you're only adding to what all the participants have said so far. You know, I already feel just I think healthier talking to all of you, and I feel grateful that I know all of you a little bit better now. I think I can get rid of my I don't need doctors anymore. I think I know where to find you guys. I think as long as I can find you, I'll be okay. But I think it's hard to summarize everything all you've said, you know, so eloquently, and so many different controversial angles and viewpoints. But yet, you know, I've heard this, you know, on sort of silver lining that, you know, that working together and in the relationship sort of between people, and you know, through you know, education, more awareness, I think we have a chance. And I really like what Siv said about you know, crisis. You know, this. Also, the Greek word krisis, right, is a decision point. So it's an opportunity. It's really an opportunity for all of us to participate in building the new system. So we, since we started a little late, let's go for maybe another 10 minutes or so. Let's, if you can just, again, let's try a blitz round. If you can just quickly comment on how you think mutual responsibility fits into this new system. And then if you can end with sort of with one word of how you felt sort of from this roundtable tonight. So again, how do you think mutual responsibility fits into this new system that you've all described? And just kind of end your comment with one word, which you think is sort of the summary of what you felt from this discussion. Zolt, go ahead.
Thank you. I might just combine the two together. But we have to understand we are no heroes. I came here with my own opinion and I thought I have all the answers to the questions, but then listening to especially the ladies, they opened up such thoughts I've never even thought in my life about, patient expectation about life and death and health. And so I'm at the moment, my head is buzzing from all the ideas that I heard from the others. So I think that's where the mutuality comes into place. If we can combine all this together and create one mosaic which is focused on health, and again that's what I also liked from the others, that we look at the person, not symptoms and not a disease, but we try to look at the human being. So I think if we do mutually trying to keep the human beings happy and content, then we can even forget about diseases. Yeah, and education I also liked, which I heard from I think 3 or 4 of you, starting with education from childhood. So thank you very much. My head is buzzing. I have to digest what I heard tonight. So it was a great experience. Thank you.
Thank you. One word from you that how you summarize how you felt in this discussion.
Well, as I say, I came with my own opinion, and I will go away with how many of us? Eight opinions in my head. That's my summary.
Thanks. Stephen, let's see if your sound's back. Sorry, Steve. We'll try it. We'll try you one more time. Sonia. So how do you see mutual responsibility? How do you fit into this new system we've all described? And if you could just end with one word that you think summarizes how you felt, thank you.
To me, mutual responsibility is an obligation and a responsibility toward our fellow men and women. And I believe that everyone should have the basic needs that they need in any kind of health care, whether they're healthy or whether they're not healthy. It shouldn't be a matter of money. It should be a matter of, all right, I think everyone needs to be given the chance to try to be healthy and try to live a better life. And I also think that mutual responsibility means that we allow people to help each other by working and contributing their time and effort to, well, because I believe in like community-based medicine too, for those who can't afford it. I just feel that it's really important for us to work in those situations. And my word is, I have two actually, but inspired. Thanks.
Thank you. Sarah?
What about Steve?
I think we'll come back to Steve. I think we're working on sound and video.
Steve? No?
No, I think we'll come back to Stephen. Stephen, if you get your audio working, just scream it out. We'll come back to you.
I'm saying Steve, not Steve.
I apologize. I apologize.
For me, Sarah can say, okay. Thank you.
My head's also spinning myself. I'm inspired. I think my computer just started working by itself now. Go ahead, Steve.
Thank you. No problem. Mutual responsibility in this scenario, I think it's many levels, but I want to get into the patient, doctor, nurse, alternative medicine. I don't care in what practice actually, but we need to change the attitude somehow, because now it's like I'm sick, somebody need to take care of me, and it should be okay. I'm sick, I need to take care of myself. I need to find the help I need to take care of myself, and I need to cooperate with all, no matter alternative medicine, with a friend, with doctors, doesn't matter, whatever I need to stay healthy, both in my head, in my spirit, and in my body. I need to make the connection with somebody, and I need to cooperate with somebody. So I think cooperation among every level of healthcare system, and let's make it a healthcare system and not a sick care system. And also, I my word here, more. That is best word I can get is let's have more of these kind of discussion, because my head is popping out of ideas here, and I want to work more with you guys. Please, thank you.
Thank you, Sarah. Okay, Sarah, go ahead now.
See, I knew there was a reason I wanted to go after Steve. That's great, Steve, and I completely share that sentiment with you. I want to get all of your details afterwards. Yeah, I think mutual responsibility and the ideas that go into it are, if we saw ourselves and our relationships as such, then we would recognize that it is mutually our responsibility to keep one another within this system of mutual responsibility, which means that no matter what field we go into, is that our work is geared towards helping one another and making sure that we all remain within this system, and that we're not profiting from people getting kicked out of this system. I think that's the main thing, because we see it in healthcare, but healthcare it's just a microcosmic representation of what we see in all of the breakdowns of the systems. So yeah, I mean, I feel hopeful, is what I feel, that it's not just a few of us out there, but really seeing each of you representing different countries, different cultures, different practices, different philosophies, different lenses of how we look at healthcare, is really, as Alex talks about, is this is how we can rebuild the system, starting from scratch, and doing it through mutual responsibility, of really recognizing that that we're responsible for one another, and then we'll all be healthy. So hopeful is my word.
Thank you. Sarah, David?
Healthcare system and mutual responsibility. I think it's very easy to explain a person what our body is not just number of single cells. It's a whole system which works together and functioning perfectly if everything treated perfectly. So if we will explain people that our society the same, it's a system, and human beings just single cells in this system, and if they will help each other, they will live much better life and much happier life. So same as a body. So our society is a whole body. So let's treat this body in a good way. Regarding today's event, I'm very, very grateful to everyone. Thank you very much, every single of you. I just happy to be here and looking forward to participate the same. round tables more and more. Thank you very much for the invitation.
Thank you, David.
Thank you.
And, Alex?
Thank you very much. Mutual responsibility. I'm mutually responsible to bring these round tables again and again and again and again, to get more connection with you and understanding. Like Zsolt says that, you know, you come one and you came out 8. And we multiplying mutual responsibility everywhere. By the way, a little remark: the alternative medicine, let's say Chinese medicine, is about 3,500 years, and current medicine is 200 years, which will go away without leaving any science to be here. And the real medicine that based on the observation of the nature and being connected to the people and giving your heart to do whatever has to be done within society, within nature, will live forever. And my word there is family.
Thank you, Alex.
Thank you.
Thank you very much. Steve, can we try your sound one last time? I don't think we can hear you, but we see you signing to us. You can write your answer maybe in chat, you know, I can read. But we're actually have really filled up time and even went over a little bit. But there's a lot of questions in chat that I don't think we'll be able to address. Address this time. But I apologize for that. But the good news is that this is not the only roundtable we'll hold. So this was the first, our first try at this, and we will hold mutual responsibility. We'll host many more in the future. So please stay tuned. The questions, the comments from the audience were very interesting. Folks are asking about, what kind of payment system would exist then. What about all the problems with drug addictions, too many drugs, and pharmacy issues are growing, and there's so nothing is free in the system, and that the effects that all aspects of the system affect our bodies and our society as a whole, and there's many more comments, and I'm really glad to see this participation. So this means that in the future roundtables, I think we'll make it more interactive. We'll be able to get the audience to participate more. Folks, again, I was very honored and grateful to have this opportunity to moderate this roundtable, and I feel very inspired. I feel very hopeful. I'm glad that some of you are planning to connect after and work and collaborate. So. Again, thank you all for participation, and let's continue these types of discussions where we're all equal, we're all respectful to each other, and we honor each other's opinions. And together, we're starting to build this new warm, caring environment. That from that, I think all problems, not just healthcare, will probably start to dissipate. So. Before we go, can we all just, wave, but then if you can just freeze for a second, I want to take a screenshot, I want to take a picture. So everybody, let's give me. Okay, perfect. Thank you.
Thanks.
Until next time, bye-bye.
Bye.
Thank you.
Bye-bye.
Bye.
Thank you.
Thank you. Really, thank you to everybody. You took such a huge inspiration. Thank you.
Bye-bye.
Thank you.
Bye-bye.